So continuing on with delusional disorder, this is the chronic presence of one or more non-bizarre delusions in a person that's never met criteria for schizophrenia. So really important, they can't have the criteria for schizophrenia. This is just a delusion only, and it's non-bizarre. So it's something that could happen actually in reality. So if someone, maybe they're paranoid someone's following them, or that their significant other's cheating on them, something like that, as opposed to bizarre with like the alien living inside their brain situation I described earlier. So DSM-4 criteria, they must have non-bizarre fixed delusion for at least 1 month, can't meet criteria for schizophrenia. It doesn't really cause any significant impairment in their daily functioning. They're able to go about their business, do their ADLs, take care of themselves, take care of their bills, go to work, have a job, have relationships, have friends. Nobody's really going to notice that they have this unless the topic comes up. If the topic of the delusion comes up, they're going to go off on it, and they're going to tell you all about their delusion. But you're never going to know unless you actually ask about it or it comes up in conversation. This also occurs more often in older patients, more than 40. For some reason, immigrants and the hearing impaired tend to have it a little bit more than the average population. Sometimes you might get a little tactile, gustatory, or olfactory hallucinations, but they're only related directly to the delusion itself. They're not their own separate thing. They're directly related to it. But auditory and visual hallucinations should absolutely not be present with delusional disorder. Non-bizarre versus bizarre delusions. You can read this over yourself in the handout, and I talked about it a little bit earlier. There's a bunch of different types of delusions. There's erotomanic. This is delusions that another person, usually a higher status, is in love with the individual. So I had a patient once who thought that Beyonce was in love with them, and that they wrote letters to Beyonce, and they just had this whole delusion about her. That would be an erotomanic type of delusion. Grandiose is, let's say they think they're a famous rock star or a famous politician or something like that. Somatic is a physical delusion. They have a physical defect or a medical illness. Now this gets really confusing with hypochondriasis, but the difference is with hypochondriasis, the patient will at least entertain the thought that the illness might not actually be present, but they're still really worried about it, and it's more like an overvalued idea versus a fixed false belief, such as this delusion is. But these people with somatic delusions may also end up getting lots of unnecessary tests and procedures, a lot like a hypochondriac would get. Persecutory delusions, this is pretty common. Delusions that they think they're being followed, they think they're being poisoned.